Hello, my name is Erin Hurst. I'm a nurse practitioner student at Auburn University, and I'm just going to give you some information about the primary roles and functions of the family nurse practitioner. I hope you enjoy. This presentation is about the nurse practitioner role. Again, my name is Erin Hurst, and I'm a nurse practitioner student at Auburn University. A nurse practitioner is a registered nurse who has completed additional education. At minimum, this is a Master's of Science in Nursing degree, but entry to practice can also be at the Doctor of Nursing practice level. The nurse practitioner is one of 4 advanced practice nursing roles. The other 3 are nurse anesthetist, clinical nurse specialist, and nurse midwives. Every nurse practitioner must have a population focus, and they choose from one of 6 populations: family, or the individual across the lifespan, adult gerontology, neonatal, pediatrics, women's health and gender issues, and psychiatric and mental health. The family nurse practitioner, which is the focus of this presentation, cares for patients across the lifespan. Nurse practitioners are expert in health promotion, disease prevention, and providing holistic care. They receive the appropriate training, both didactic and clinical hours, in order to diagnose and treat medical conditions, order and interpret laboratory and diagnostic tests, prescribe medications, and educate and counsel patients and families. Family nurse practitioners typically manage chronic problems while also attending to acute episodic issues, such as bronchitis, muscle strains or sprains, urinary tract infections, and other issues. The nurse practitioner role was first certified in 1976. In the intervening 43 years, 270,000 registered nurses have taken the additional steps to become a licensed nurse practitioner. 66% of those individuals have chosen the family population focus, which means they're going to care about the patient throughout their lifespan. 72% of nurse practitioners provide primary care services, and a total of 53% of all nurse practitioners have privileges in hospitals and long-term care facilities. The nurse practitioner role is regulated by the Board of Nursing for individual states, meaning there is a variation from state to state in the nurse practitioner's scope of practice, collaborative agreements, and prescriptive authorities, which means in every state, there's a little bit different things that the nurse practitioner can and cannot do. The nurse practitioner can work in a variety of settings, including medical clinics, urgent cares, emergency rooms, VA clinics, and retail clinics such as the Minute Clinic. The nurse practitioner remains a highly sought-after individual as their education and training allows them to see all patients across the lifespan. However, as the family nurse practitioner cannot care for patients in acute or life-threatening situations, they may be required to receive additional training and/or certifications in order to work in some specialty areas, such as in emergency rooms. Depending on the state, family nurse practitioners may be able to own and run their own healthcare practice. And in many rural areas, there are opportunities for the family nurse practitioner to work short-term contracts, which allows a greater exposure to different patient populations. There are approximately 400 academic institutions across the United States that have a nurse practitioner program at either the MSN or the DNP level. In order to practice as a nurse practitioner, one must graduate from an accredited nurse practitioner program. Accredited programs typically utilize the National Organization of Nurse Practitioners faculty's 9 core competencies and the American Association of Colleges of Nursing's 9 essentials when developing their curriculum. This provides some degree of standardization among the programs. In addition, all students must take and pass 3 core courses: Advanced Health Assessment, Advanced Pathophysiology, and Advanced Pharmacology. Every nurse practitioner program also has a clinical component, although the hours that are required varies from program to program. In order to move into the role of the nurse practitioner, one must first be a registered nurse. Therefore, every nurse practitioner student comes with a unique background and experience level that they can draw upon when learning to work within their new role. Prior to practice, the nurse practitioner must pass one of 2 certification exams. These exams are the American Academy of Nurse Practitioners National Certification Board and the American Nurses Credentialing Center Certification Program. Both of these certifications allow the family nurse practitioner to apply for licensure in any state. There are 5 main roles the nurse practitioner must fulfill, which are expert clinician, consultant, manager or leader, educator or teacher, and researcher. The nurse practitioner can fulfill these roles in a variety of ways. The family nurse practitioner completes the role of the expert clinician by being a frontline healthcare provider who delivers care to all populations and has the ability to treat a multitude of conditions. The family nurse practitioner utilizes the education they receive to provide quality healthcare that is safe and effective. The family nurse practitioner fulfills the role of consultant by working within an interdisciplinary team to improve patient care while reducing healthcare associated costs. In many states, the family nurse practitioners are able to be independent practitioners, thus being a manager or leader in their own clinic. Even in states with more restrictive authority, the family nurse practitioner is leader of individual and community level healthcare initiatives. Nursing is a field based on effective communication. As such, the family nurse practitioner assesses and manages health problems while incorporating health promotion and disease prevention into all aspects of care. By doing this, the family nurse practitioner fulfills the role of educator and teacher. Finally, in the role of researcher, the family nurse practitioner utilizes current evidence-based practice guidelines in assessing, diagnosing, and treating patients while emphasizing continuity of care, reduced healthcare costs, and enhancing healthcare outcomes. Like many parts of healthcare, the nurse practitioner role is constantly evolving with new research and new standards of practice. 3 hotly debated topics include increasing the practice authority and prescriptive authority of nurse practitioners and changing the practice entry level. Currently, the family nurse practitioner has full practice authority in 22 states and Washington, D.C. This means that they can provide practice independently without a collaborating physician. 16 states have reduced practice authority, meaning that nurse practitioners require a collaborating physician for at least one aspect of the care they provide. And 12 states have restricted practice authority, meaning they require team management, delegation, or supervision by a physician in order to practice. The Nurse Practice Act governs the nurse practitioner's scope of practice. These acts are influenced from healthcare-related state laws and require political support to make any changes. As such, many national and local organizations are working to increase the public awareness of nurse practitioners' education, training, and abilities in order to improve healthcare to underserved populations. In order to achieve these improvements in practice authority and in prescriptive authority, many states have bills working their way through legislation that would increase both the practice and prescriptive authority of nurse practitioners. This would allow nurse practitioners to practice without a collaborative physician. With the increase in practice authority comes a debate about which level of education is appropriate into practice, DNP or MSN. The MSN is the minimum level of education that a nurse practitioner can hold in order to practice in the role. A DNP is a terminal nursing degree. Although this debate has been ongoing for several years, it is entirely possible that in the future, new nurse practitioners must obtain a DNP prior to becoming certified and practicing in their new role. Thank you very much. So I know that was a lot of information. Here are the key takeaways from this presentation that I hope you remembered. There are 4 main takeaways that I hope you get from this presentation. The first is that nurse practitioners are highly educated individuals who have been proven to provide safe and effective care, often in underserved populations, that is comparable to the care that physicians provide. The second is that family nurse practitioners are a unique role in healthcare, with the cornerstone of our education being therapeutic communication and holistic care. This means that while we are able to provide many of the same services as physician assistants or medical doctors, we bring a unique approach to all interactions with our patients. We look at the whole patient and not just at the presenting symptom. We also care for the whole family. The third key takeaway is that many states are actively working on increasing the ability of nurse practitioners to have full practice authority, which would allow nurse practitioners to work without a collaborating physician. In addition to allowing nurse practitioners to work to the full extent of their education, this is also a way to improve healthcare disparities that most often affect underserved populations. And finally, as healthcare changes, so does the role of the nurse practitioner. With increased practice authority and increased entry into practice regulations, the role will continue to change as healthcare moves forward.